All right, let's talk about something that can really stress out new parents. What to do when your baby is having trouble pooping. It's a super common worry, so if this is you right now, trust me, you are definitely not alone. So, does this sound familiar? Your little one is straining, crying, maybe just extra fussy, and it's been a few too many days since that last dirty diaper. I totally get it. It's so hard when you can see they're uncomfortable and you just feel completely helpless. But hey, don't you worry, you've absolutely come to the right place. We are about to walk through some safe, gentle, and really effective tips that can help get things moving and give your baby some much needed relief. Okay, so first things first. Before we jump into all the solutions, we got to make sure we're actually dealing with constipation, right? So let's talk about the key signs you should be watching for. It's so easy to just focus on how many days it's been, but the real clues, they're in how your baby is doing. You want to look for hard little pebble-like poops, a belly that feels kind of firm to the touch, or if they're clearly straining and crying when they try to go. And yeah, fewer diapers can be a sign, but infrequent really changes as they get older, so those other clues are way more reliable. So, once you're pretty sure that's what's going on, you can start helping. Let's start with some simple physical techniques that can work wonders just by gently stimulating your baby's digestive system. You've probably heard of this one, right? The good old bicycle legs. And for good reason, it totally works. Just lay your baby on their back and gently cycle their legs. You're not just moving their limbs, you're actually putting a little pressure on their abdomen, which helps wake up the intestines. It's simple, it's soothing, and it's often a really effective first step. And if the classic bicycle legs aren't quite cutting it, here's a little variation. Some parents call it the omelet fold. You just gently push their knees up towards their armpits. This position actually mimics a natural squat, and that angle can be even better at helping them go. And this is just a brilliant example of how a simple change in position can make all the difference. I'm talking about the legendary poop chair. Seriously, so many parents swear by this. An upright bouncer, or even just their car seat, can sometimes work magic. Why? Well, it's that combination of the upright angle and their natural leg kicking that can often trigger what parents lovingly call a poop explosion. Okay, another fantastic tool to have in your toolbox is massage. And here's a pro tip. Try it right after a warm bath. Their tiny little tummy muscles will already be nice and relaxed, which can make the massage even more effective. So the most common technique is the clockwise tummy rub. Using your fingertips with gentle but firm pressure, you're just going to rub in a clockwise circle. And there's a reason for this clockwise direction. It's not just random. It actually follows the natural path of their digestive system, kind of guiding everything along in the right direction. Want another great technique? This one's called the I love you stroke. It sounds sweet and it's super helpful. You basically trace an I down their left side, then an upside down L across the top and down the right, and finally an upside down U all the way across their belly. It's just another really structured way to massage along the path of the colon. And here's one more super gentle option for you. Just try laying your baby tummy down right across your lap. The pressure of your legs against their belly is naturally comforting, and then you can add a nice soothing back rub. It's gentle pressure and a calming massage all in one. Alright, so those physical tricks are awesome for getting some immediate relief. But if you're looking for a long-term fix, especially once your baby has started solids, the solution is very often found in their diet. So to really get this, we have to talk about fiber. What is it, really? Well, it's this amazing nutrient that kind of does two jobs at once. First, it attracts water into the poop to make it softer, and second, it adds bulk, which helps physically move everything along. You really need both for a healthy system. Here's a super easy way to remember the best foods to grab. Just think of the pea fruits. We're talking peaches, plums, pears, and papaya. And of course, the one everybody thinks of. Prunes. They are the granddaddy of them all for a very specific, sciencey reason. Prunes have this natural substance in them called sorbitol. Sorbitol is basically a natural laxative that works by drawing extra water into the intestine, which really helps soften things up and get the show on the road. So what about just giving them some extra water? It's a good question. For babies over 1 month old, yeah, a little bit of water or maybe some diluted pear or apple juice can definitely help. But, and this is a big but, you always have to check with your pediatrician first before giving a baby anything other than breast milk or formula, especially when they're very young. Okay, we've gone over a ton of great, gentle tips, but now we need to talk about something really important, the red flags. It is absolutely crucial to know when constipation might be a sign of something more serious, something that needs a doctor's attention. So it is absolutely vital to know when you need to get medical help. You need to call your doctor right away if you see any of this stuff. Blood in the stool, or if their poop is black, gray, or white. Also look out for a belly that's severely swollen or really hard, any vomiting or fever, or if your baby is refusing to eat, or is just way more tired than usual. And one more big one, any constipation at all in a newborn's first month should always be a call to the doctor. Look, these tips are going to work for most babies, but you have to remember that every single little one is different. What works like a charm for one might not do a thing for another. The real key here is to just be patient and stick with these gentle, loving approaches. You're doing a great job, and your little one will find relief. So, after all of that, what's the one thing you really need to take away from all this? It's this. Your best tools are not some complicated medicine or procedure. Nope, they are consistency, patience, and just your gentle, loving care. Trust your gut, try these simple techniques, and know that you absolutely have what it takes to help your baby feel a whole lot better.
For more educational videos about baby development, like and subscribe.